specific phobias, their signs, symptoms, and treatments. I'm Andrea Brognano. I'm a licensed mental health clinician. I specialize in anxiety, and I'm here to go over specific phobias, their signs, symptoms, and treatments. So first, what are phobias? Phobic disorders are anxiety disorders, where the symptoms of anxiety are experienced only in response to a very specific fear. These can include fears of people, places, things, or even situations. When a person with a specific phobia encounters their fear, their experience is intense with anxiety and is excessive in relation to the actual risk they are in. While they are at least partially aware that their anxiety is irrational, they often feel powerless to change the response. Phobias fall into 5 distinct categories, with each category containing several subtypes. The 5 categories of specific phobias are natural environment type, including phobias of water, storms, and natural disasters. Blood injection injury type, including phobias of cuts, blood, and getting injections or IVs. Animal type, including zoophobia, which is the fear of animals, and phobias of insects, spiders, snakes, or dogs. Situational type, which includes phobias of flying, elevators, driving, or being in enclosed spaces, and other miscellaneous type. So it includes the fear of all other phobias which don't fit into the other categories. Specific phobias versus other anxiety disorders. While all types of anxiety disorders feature symptoms like high levels of anxiety, disproportionate responses, and avoidant behavior, specific phobias are triggered only by certain objects or situations. So, for example, a person with a fear of spiders will only be triggered by spiders unless they also have another phobia as well. When a person experiences anxiety in response to many triggers, other anxiety disorders like generalized anxiety disorder are sometimes suspected. However, if a person's anxiety is very limited in scope, they may be struggling with a specific phobia. So what are the most common phobias? While there are many different kinds of phobias, some are much more common than others. These include situations or things that people are more likely to encounter on a somewhat regular basis, as well as the fears that are more likely to become problematic enough for a person to seek professional help. Some of the more common phobias include agoraphobia, which is a fear of public spaces, claustrophobia, which is a fear of small enclosed spaces, and tomophobia, which is a fear of insects, arachnophobia, which is a fear of spiders, glossophobia, the fear of public speaking, and aerophobia, a fear of flying. Symptoms of specific phobias include a persistent fear that is excessive or unreasonable and occurs when a person encounters or anticipates a specific object or situation, exposure to the feared object or situation that leads to immediate symptoms of anxiety, a recognition that the fear is excessive or that the response is disproportionate, the phobia is avoided or endured with intense distress, the avoidance, anticipatory anxiety, or distress experienced before or during the situation interferes significantly with the person's routine, work, relationships, or social activities. The fear is persistent and occurs for at least 6 months, and the anxiety and avoidance cannot be better explained by any other mental health disorder, like a different anxiety disorder such as PTSD. Outward signs of phobia. Of specific phobias. Specific phobias cause people to experience intense anxiety and distress during times when they think about, anticipate, or encounter a feared situation or object. Anxiety can be experienced differently by people, but involves specific changes in a way a person can think, feel, and behave. These changes include change in thinking, which includes racing thoughts and what-if thoughts in which a person imagines or visualizes a terrible outcome. Changes in emotion. This includes intense stress, anxiety, panic, and sometimes irritability. Changes in bodily sensation. It includes racing heart, shortness of breath, tense, stiff, or rigid muscles, rushes of nervous energy, stomach upset, and dizziness. Or changes in behavior. This includes panic response, running, screaming, crying, and an avoidance of any situation where the person believes there is such a chance of encountering the fear, object, or situation. So you might be wondering what causes a phobia. Specific phobias, like other mental health conditions, are caused by a complex interplay of biological and environmental factors. Some risk factors are known to increase a person's risk of developing any mental health disorder. These factors include having a family history of anxiety, experiencing childhood trauma and being exposed to drugs or alcohol at a young age, or experiencing the loss of a separation of a parent in childhood has also been found to increase the risk of mental illness. Specific phobias often, but not always, develop after having a frightening experience. From a social learning perspective, researchers believe that phobias are learned through experience that can occur in 3 different ways. The learned experience that may lead to a phobia are direct learning experience. This is when a person has a traumatic or stressful experience and subsequently develops a phobia. For instance, a person might develop a phobia of dogs after being bitten by a dog. Observational learning experience. This is when a person observes others having a strong fear reaction to an object or a situation, and then they develop a response negatively for themselves. For example, a person might grow up with a parent who is afraid to leave the home and has agoraphobia, and later goes on to develop that same phobia. Informational learning experience. This is when a person develops a fear after learning some information, instead of having directly experienced or witnessed this situation. For instance, a person might develop a phobia of flying only after read about a plane crash in the news. So, how are specific phobias diagnosed? Diagnosis of phobias are dependent on the individual and situation they are in. Many people are aware of what their fears are and try to find ways to manage their own. They don't necessarily see the formal diagnosis as a requirement and have already accepted this is a problem for them. For others, it can come in therapy or other situations which highlight an oddity of why someone may be having the way they are, or someone acting fearful at a party. They might not understand what they have as a phobia versus a personality trait and need to seek treatment from a therapist and psychiatrist to get a formal diagnosis and understand their symptoms. A formal phobic disorder diagnosis can only be made by a licensed health or mental health professional. This usually occurs during an initial appointment with a licensed counselor, psychologist, or psychiatrist, but may also occur during the other visits with medical professionals. Thankfully, specific phobias are highly treatable. While treatment might include therapy and or psychiatric medication, therapy is recommended as a frontline solution. One kind of therapy, called exposure therapy, has proven to be specifically effective in treating specific phobias. Exposure therapy is a type of cognitive behavioral therapy that involves a trained counselor helping a person become desensitized to their fear through repeated exposure. This exposure happens gradually, usually beginning with thought exposures, where a person is asked to think of the fear situation and gradually move into anxiety-provoking situations. Over time, exposure therapy has been proven to reduce anxiety and in some cases, even resolve it entirely. If you are feeling that you're experiencing a social anxiety disorder or specific phobia, reach out and look for help. Be sure to find a clinician that is trained in phobias and work together for the treatment plan that's right for you.